Well, we are already chatting about it. Next week, October 18th, is World Menopause Day. And even though more and more women are speaking openly about their peri and menopause journeys, there's still a lot of confusion about when menopause starts and when women should seek treatment, leading to many women suffering in silence.
So to help us cut through the noise and get straight to the facts, we have doctor and researcher Dr. Nanette Santoro, chair of obstetrics and gynecology at CU Anschutz School of Medicine. We're so excited to have your expertise here and to really dive in. But let's start really basic and then we can get into the specifics. Describe, what is perimenopause and menopause?
Well, we know the menopause transition lasts on an average of about 4 years for women. On average begins around age 47, ends at around age 51. And during that time period, cycles can be very irregular. Hormones are irregular, they're up, they're down, and that of course causes some of the classic symptoms that we see. The typical one being hot flashes, which begin pretty early in that process. You know, women will notice that they're starting to have them. They are at their maximum when women are right about that year before they have their last menstrual period. And then they will slowly go down, but again, on average, they last for about 7 years, and about 85% of women will report having them.
So when do we know that we're in it? And I talk about it on this show, and then I'll get viewer responses saying that they're kind of figuring out whether they're in perimenopause, menopause as well. You mentioned symptoms. So I have read all things, because I've gone down the rabbit hole trying to figure out what's going on with me, because my menstruation has definitely changed, someone who was really regular. My sleep is worse. I just don't feel like myself. To that point, when I go to a doctor, I'm told to test your hormones. My hormones look normal. So is that how you determine if you're in perimenopause, or is it more symptom-based? What do we do here?
Well, first of all, the testing almost never is necessary.
Really?
Rarely do you need to do testing, because if it walks like a duck and it quacks like a duck, it's a duck. If you're getting irregular periods, you're in your mid-40s, and you're having some of these classic symptoms, which are hot flashes, they are sleep, vaginal symptoms can happen, and mood symptoms. So some women will have mood changes.
I'm so much more irritable than I used to be.
Irritable is right on the nose. So that's one of the ones that appears early. And then as women get later in the transition, they are actually a little more vulnerable than they are in other periods of life to depression and anxiety. So those are also things to look out for. And all of these things are treatable. But if you've got one of these, you've got an Apple Watch like I do, you can track, there's many ways to track cycles. And if you have a difference in your cycle length of more than 7 days, then you have entered the transition. You do that twice,
I've entered the transition.
you're there.
Yep.
If you've skipped a cycle and you used to be regular, you've entered the transition. If you've had a hysterectomy or you're taking birth control pills, we don't have good data to tell exactly when that's starting. But if you do get any of these symptoms, and it's really the big four, it's the hot flashes, the sleep, the mood, the irritability with mood, and sometimes vaginal symptoms. Those are all clues it's happening.
Okay.
Excuse me, there is so much confusion because I know so many people, all you hear is about like hormones, taking hormones and hormone replacement therapy, but then there's a lot of science, or I don't know if it's science or, you know, talk out there that that's not necessarily the best thing for you, or it can be dangerous in different ways. How do you navigate that? Are hormones for everyone?
Hormones are not for everyone, and it really depends on what the symptoms are. So a good clinician, and there's many people who are certified now, there's the Menopause Society will certify people in menopause practice. So a menopause certified practitioner, you can look them up online, is a good place to start. Depending on the symptoms and depending on what a woman wants to take and what her health risks are, hormones may be a very good answer. For others, they're not. And there's non-hormone treatments that work very well.
Like what?
Good to know, yeah.
What non-hormones?
Well, for things like hot flashes, which is usually the biggest symptom and the biggest driver, hormones work great. There's now brand new medications. There's one that's FDA approved, and there's one that is pending approval that treat hot flashes at their source, which is in the brain. And they treat it, they essentially bypass estrogen. They do the job of estrogen for you. So they're almost as effective, and they help you sleep a little bit. So they kill two birds with one stone. For other women that don't or can't take that medication, classic antidepressants work. They don't work like antidepressants. They work much quicker, so you don't take 6 weeks to work like they will if it's for depression. So they work very quickly. And they seem to be helpful maybe about half the time. And there's some other medications that are used for nerve pain and medication used for overactive bladder. These have actually been tested mostly because women who have had breast cancer who can't take hormones would have hot flashes. They would be on these medications for another reason. They'd go to their doctor. The doctor would say, tell their doctor, you know, whatever you gave me, my hot flashes got better, and then they would be tested more systematically.
This is encouraging because I feel like that we're getting answers and there's just too much noise out there. Really quickly, before we let you go, we have about 30 seconds left. Does menopause affect women differently, whether you have children, your race, your ethnicity?
Yes, very important. I'm glad you brought it up. There are differences. Now, this is race, ethnicity. The study of women's health across the nation published fact sheets on this, so a great place to look it up. But race and ethnicity, as you define yourself, not necessarily genetically or anything like that, do influence the symptom experience. So we know for Black women, hot flashes last longer.
Why?
They tend to be worse. Don't know why.
Wow.
But that seems to be the case on, on average. Everyone's an individual, but some of these things seem to, you can at least use them to predict.
Wow. This is, I feel like a part one. I hope we can have you back, but thank you so much for everything that you've described today.
Dr. Santoro, thank you for being here.
Great. Thank you. Thanks for having me.